After the APGAR assessment has been performed, on a more continuing basis, you're going to be doing physical assessments. First, with the general survey, you're going to be assessing muscle tone, symmetry, respiratory effort, alertness of the infant, and the interaction with the parent. You're also at this time looking for any signs of abuse or neglect, such as poor hygiene, inappropriate dress if it's cold outside and the infant doesn't have a jacket, or any physical signs such as burning or bruising. As far as vital signs, for a temperature, an infant, you always are going to want to take an axillary temperature, and the range is the same as that as an adult, so 97.7 to 98.6. For pulse and respirations, you're going to listen for a full minute. Apical pulse should be 110 to 160 beats per minute, and respirations should be between 30 and 60. Blood pressure is not normally used for infants, but if they are taken, the systolic blood pressure should be between 50 and 70. Assessing per pain, you're looking for excessive irritability, and the parent may be able to help you if they notice that the cry is out of the norm for their infant. As far as measurements, you're going to take their weight, you're going to zero the scale, lay a blanket over the scale to keep the infant from getting cold, and then while they're on the scale, you can go ahead and do your measurements. You're going to measure with your measuring tape from the crown to the heel, then also around the chest and around the head. At its largest point around the head and chest. Next, you're going to assess for nutrition. You're really looking at the hair, skin, and nails. The hair should be shiny and soft. The skin should be soft and supple. The infant should be saturating 4 to 6 wet diapers a day, or having about 2 bowel movements. That's a good way to assess if the infant is breastfeeding. If they're formula feeding, they should be getting about 100 calories per kilogram per day, and you can calculate that using the label on the back of the formula container. The infant should have no signs of dehydration, so their skin should not be dry. They shouldn't have dry membranes. The fontanelle should be flat, not sunken. And their growth should be progressing in a forward manner. They should not be regressing, losing weight, or not reaching those milestones. Next, the mental status. You're looking for inconsolability, excessive irritability, or inability to arouse. Those are all abnormal.